Good morning, students. Today's topic is adverse drug reactions. By the way, myself, Emma Shri, Assistant Professor in the Department of Pharmacy Practice in AMRM College of Pharmacy, Ashram. So today we are discussing regarding the areas. Objectives are mainly definition of terms associated with the adverse drug reactions. In short, we are calling it as ADRs, and classification of ADRs, discussion on each type of ADR with examples. Definitions. So when coming to the definitions, we have two definitions here. One is for adverse event and another one is adverse drug reactions. So adverse event means any untoward medical occurrence that may present during treatment with a pharmaceutical product, but which does not necessarily have a causal relationship with this treatment. And adverse drug reactions here, any noxious change which is suspected to be due to a drug. So here drug is involved, occurs at doses normally used in man or population, requires treatment or disease in dose or indicated caution in future use of the same drug. Therefore, an adverse drug reaction is an adverse event with a causal link to a drug. So when coming to this flow chart, you can see here example. So once the drug is administered, the patient develops a new condition or symptom. That one we are calling it as adverse event. So if there is any drug is present, if drug is suspected, if it is yes, then we can go and check the literature. So why we are checking for the literature means if it is documented or not. So in ADRs generally, the new ADR generally we are calling it as signal. So here in literature, if the type of reaction is documented, then we'll go for checking. If it is yes, if it is any presence of that particular reaction, then you can say highly suggestive ADRs. And another one is not documented in literature. If that particular ADR is not documented, then once the drug is continued, the worsening symptoms occurs. The symptoms are worsened, then you can go for the possible causes. You can check for the possible causes such as like concomitant therapy, underlying conditions. Okay. And next one, drug discontinued. Once the drug is discontinued, so symptoms improved. That one we are calling it as like pause to D challenge. So next one, we can after some time we can restart the same drug. Okay, so then you can check if the symptoms are reoccurring or not. Okay, so if the symptoms are reoccurring, that one we are calling it as a positive re-challenge. And generally adverse in the sense it's not not wanted, okay, untoward reaction or unintended reactions possibly causing harm or noxious conditions. Okay, so adverse event in the sense here, so it's a noxious event or unwanted event or effect or experience. When coming to ADE, adverse drug event in the sense, an adverse event which happens in a patient taking a drug. Okay, generally patient who are taking drugs, so there generally happens this type of drug events. And when coming to the adverse drug reactions, an ADE in which a causal association is suspected between the drug and the event. So here the relationship between drug and event is possibly present. So here this diagram represents adverse drug events. There is no need to have a causal relationship, but in adverse drug reactions, there is a causal relationship in suspected and or established. So classification as per generally we are classifying these ADRs into 4 types. First one is onset of event. So it depends on mainly timing, duration. So we are dividing it into acute, subacute, and latent. Acute here the time duration mentioned is less than 60 minutes. So within the 60 minutes the event may present. Subacute is 1 to 24 hours and latent is greater than 2 days. So type of reaction here we have some type of reactions are present. So coming to this one, type A we are calling it as augmented reaction. Type B is bizarre reaction. C is chemical. D represents delayed. E represents exit, and F is familial. G is genotoxicity. H is hypersensitivity. U is unclassified. Okay. And next one, based on severity, they classified it into 4 types: minor, moderate, severe, and lethal ADRs. And other types are side effects, secondary effects, toxic effects, intolerance, idiosyncrasy, drug allergy, photosensitivity, drug dependence, drug withdrawal reactions, and teratogenicity, mutagenicity, carcinogenicity, and drug-induced diseases. So these are the overall classifications we are studying upcoming slides. So next one, the classification mainly driven by Wills and Brown. So this classification is based on the types, type A, B, C, as I discussed earlier, D and E, F, G and H, U. So type A in the sense like we are calling it as augmented reaction. So this is a reaction which can be predicted from the known pharmacology of a drug. And it also dose dependent and can be alleviated by a dose reduction. So here the reaction mainly depends on the drug, okay, drug pharmacological action. So when there is any adverse event based on the dose, if you are reducing or tapering the dose, so the reaction may suppress. So examples are here anticoagulants, it causes bleeding, beta blockers causes bradycardia, and nitrates causes headache, and prazosin causes postural hypotension. And type B, bizarre reactions. This reaction cannot be predicted from the pharmacology of the drug. So here there is no pharmacology involved, not dose dependent. So surely it won't depend on the dose. Post dependent factors important in predisposition. Examples are penicillin, it causes anaphylactic shock, anaphylaxis we are calling, anticonvulsants, hypersensitivity reaction it causes. Type C, chemical reactions. So biological characteristics can be predicted from the chemical structure of the drug or metabolite here. So example, paracetamol causes hepatotoxicity. Sorry. Next, type D, delayed reaction. D indicates delayed. So here delayed reaction. So it means it occurs after many years of treatment and can be due to accumulation. Okay. So here the event or reaction happens after a long time. Okay. So examples are chemotherapy. So chemotherapy will be for a prolonged duration. So it may lead to secondary tumors. And next one, phenytoin during pregnancy. It causes teratogenic effects. So it mainly, teratogenicity means it mainly causes birth defects in fetus. And antipsychotics, it causes tardive dyskinesia. It's already neurological related disease. And analgesics, it causes nephropathy. And the next one is type E, end of the treatment reaction. So generally it occurs on the withdrawal, especially when drug is stopped abruptly. Examples of phenytoin withdrawal, it causes seizures. So when the drug is withdrawn, so generally it's showing some type of events or reactions. That one we are calling type E reactions. Okay. So here steroid withdrawals. So generally what happens here? So there is a adrenocortical insufficiency. The next one, classification of ADRs depending on severity. So here it's based on severity. There are 4 types: minor ADRs, moderate ADRs, severe ADRs, and lethal ADRs. So when coming to minor ADRs, there is no therapy required. So antidote or prolongation of the hospitalization is required. So in moderate ADRs requires change in drug therapy, specific treatment, or prolonged hospital stay by at least 1 day. And severe ADRs, there is potentially life-threatening and causes permanent damage or requires intensive medical treatment. So when coming to the lethal, it directly or indirectly contributes to death of the patient. This is the final stage. Next one, what is meant by side effects? So side effects are, these are the unwanted but often unavoidable. So we can't avoid this type of effects. Pharmacodynamic effects that occurs at therapeutic doses. Okay, there are some pharmacodynamic effects will be occurs at therapeutic doses. Okay, predicted from the pharmacological profile of a drug. Generally, we can predict those reactions from the pharmacological profile of a drug. It's known to occur in given percentage of drug recipients. Okay, so like how we can identify this type of side effects in the sense we can identify when we are giving this dose to like drug recipients. Okay, percentage of drug recipients we can calculate this one. Examples are side effect based on therapeutic effect. So example, atropine, it causes dryness of the mouth, and esthezolamide, it causes acidosis. And there is another one, side effect based on a different location. So example, promethazine, it's an anti-allergic, but it causes sedation by using. Okay. Next, another one, estrogen, it causes nausea and vomiting, you know, right? Depending on the context, codeine, it's a anti-tissue, but causes constipation. Okay. Generally, it's a cough medicine. So, but causes side effect is constipation. But this side effect can be used as an useful effect by using this in a traveler's diarrhea condition. Next one, drug discovery. Occasionally, adverse effects may be exploited to develop an entirely new indication of a drug. Okay, so generally, adverse effects generally we are using it to develop an entirely new indication of a drug. So, drugs new indication will be we can use for these adverse effects. Examples: unwanted hair growth during minoxidil treatment of severely hypertensive patients. So, developed of the drug for hair growth. Generally, minoxidil is an antihypertensive medication, but when they are when the patient is taking this type of medication, the side effect is hair growth. That one we are calling it as a hirsutism, right? So, the side effect of this minoxidil in later on, it's developed as they prepared minoxidil hair growth serums or hair growth lotions. Sildenafil was initially developed an anti-anginal, but its effect to alleviate erectile dysfunction, a new drug indication in erectile tissues. Okay, so sildenafil is category of anti-anginal actually, but its effects, based on its effects, this can be used in the treatment of erectile dysfunction. Next one, secondary effects. So these are indirect consequences of the primary action of the drug. So primary action of drugs, indirect consequences. One example, tetracyclines, it causes suppression of the bacterial flora. Then the secondary action, what happens when there is a suppression of bacterial flora, then there is a super infection happens. Corticosteroids, it weakens the host defense mechanism. So there is a activation of the latent tuberculosis. Generally, tuberculosis occurs in the patients who are in immune deficit condition. So such as like adults 65 years elder, and next one children less than 3 months age. So in that cases, generally tuberculosis mostly occurs. They are vulnerable cases. Okay, so they are more prone to get this tuberculosis condition. Toxic effects. So toxic effects are results of excessive pharmacological action of the drug due to overdoses or prolonged use. So overdoses may be two types, absolute and relative. So absolute, like such as accidental or homicidal or suicidal. So intentionally they'll take overdose. Okay, and relative in the sense like example is gentamicin in renal failure. In such renal conditions, we are using gentamicin. Because of the gentamicin, there may be a toxic effect occurs. Okay, so results from general examples are extinction of the therapeutic effect, such as barbiturates, it causes coma, digoxin causes complete AV block, heparin causes bleeding. So excessive uses of heparin causes bleeding. And functional alteration such as atropine, it causes delirium. And drug-induced tissue damage, it causes paracetamol causes the hepatic necrosis. Next one, intolerance. So intolerance means appearance of characteristic toxic effects of a drug in an individual at therapeutic doses. Converse of tolerance indicates a low threshold of an individual. Examples, you can see carbamazepine, it causes ataxia in some individuals. Okay, so ataxia is a sign, it's not a disease. And next one, triflupromazine, single dose causes muscular dystonia in some individuals. And chloroquine, you people know this one. This one causes vomiting and abdominal pain in some individuals. So this one we are talking about the intolerance. Idiosyncrasy. So this one is genetically determined abnormal reactivity to a chemical. Certain bizarre drug effects due to peculiarities of an individual for which no definitive genotype has been described are also included in this idiosyncratic effects. Drug interactions with some unique features of individuals not found in majority subjects and produce the uncharacteristic reactions. Examples are barbiturates that in that conditions generally excitement and mental confusion in some individuals happens. Quinine, it causes cramps, diarrhea, asthma, vascular collapse in some individuals. Chloramphenicol, it causes aplastic anemia in rare individuals. So aplastic anemia, there is no presence of RBC. The next one is drug allergy. Immunologically mediated reaction producing stereotype symptoms unrelated to the pharmacodynamic profile of the drug. So there is no related to the pharmacodynamic profile of the drug. So generally occurs even with much smaller doses, also called drug hypersensitivity. So there are 4 types: type 1, type 2, type 3 and type 4. So we know there are some drug allergy reactions types are there. So type 1 is immediate or anaphylactic. So here the immunoglobulins are IgE. This type 1, type 2, type 3 reactions we are calling it as humoral immunity, and type 4 is cell mediated immunity. So here for type 1 it's a anaphylactic reactions, right? Here example, penicillin, it causes anaphylactic shock. Type 2 is cytotoxic antibody, and immunoglobulins are IgG and IgM involved. Example, methyl dopamine causes hemolytic anemia. And third one is serum sickness, IgG and IgM. So there is a presence of antigen antibody complex such as procainamide induced lupus. So these 3 are comes under humoral immunity, and type 4 is delayed hypersensitivity T cells. T cells, example, contact dermatitis. Photosensitivity. So this one, it's a cutaneous reaction resulting from drug-induced sensitization of the skin to UV radiation. The reactions are of 2 types: phototoxic and photoallergic. Phototoxic means drugs or its metabolites accumulate in the skin, absorbs light and undergoes photochemical reaction, resulting in local tissue damage such as sunburn, that is like erythema. Erythema means redness of the skin. Edema means it's a swelling of the particular area. Blistering and hyperpigmentation. Examples here: tetracyclines and tar products, nalidixic acid, fluoroquinolones and sulfones, etc. When coming to photoallergic, drug or its metabolite induces a cell-mediated immune response which on exposure to light, longer wavelength light, right, produces a popular or eczematous contact dermatitis like type. Example: sulfonamides, sulfonylureas, griseofulvin, chloroquine and chlorpromazine. Drug dependence. Here there are 2 types. Generally, drugs capable of altering mood and feelings are liable to repetitive use to derive euphoria, withdrawal from reality, social adjustment. Psychological dependence and physical dependence. There are 2 types. Psychological dependence is individual believes that optimal state of well-being is achieved only through the actions of the drug, suppose such as like drug addiction. Examples are opioids and cocaine. Physical dependence is altered physiological state produced by repeated administration of a drug, which necessitates the continued presence of the drug to maintain physiological equilibrium. Discontinuation of the drug results in characteristic withdrawal syndromes. So here what happens? There is a dependency. When there is a drug withdrawal happen, there is presence of some withdrawal syndromes. Example: opioids, barbiturates, alcohol and benzodiazepines. So there is drug abuse and drug addiction and drug habituation. So drug abuse means use of a drug by self-medication in a manner and amount that deviates from the approved medical or social pattern in a given culture at a given time. Drug abuse refers to any use of an illicit drug. Drug addiction means compulsive drug use characterized by overwhelming involvement with the use of the drug. And drug habituation means less intensive involvement with the drug. Withdrawal produces only mild discomfort. Habituation and addiction imply different degrees of psychological dependence. Next one, drug withdrawal reactions. Sudden interruption of therapy with certain drugs result in adverse consequences, mostly in the form of worsening of the clinical condition for which the drug was being used. Okay, so there is a sudden interruption of the therapy. So if they are removing suddenly the drug, so generally there is some reaction will be present. Example, corticosteroids. So if they are withdrawing this corticosteroids suddenly, what happens? There is a adrenal insufficiency happens. Beta blockers, generally it worsening the angina and precipitates the myocardial infarction. When coming to clonidine, it causes severe hypertension, restlessness, and sympathetic overactivity. Next one, teratogenicity. You people well know about this one. It means the capacity of a drug to cause fetal abnormalities when administered to the pregnant mother. So, drug can affect the fetus at 3 stages. First one, fertilization and implantation, conception to 17 days. Okay, that means the day of conceiving to 17 days. So, failure of pregnancy, which often goes unnoticed. In these conditions, generally, there may be a presence of failure of the pregnancy, and generally it is unnoticed. Okay, and organogenesis. Second one is organogenesis. That one 18 days to 55 days duration. So this stage is most vulnerable period. Deformities are produced. Here there is a formation of deformities may be possible. And growth and development, it's greater than 56 days. So here this is the developmental and functional abnormalities can occur. Here there may be a developmental and functional abnormalities will be appear or develop. Examples are thalidomide. Okay, so phocomelia and multiple defects. Phocomelia in the sense limbless fetus. Okay, anti-cancer drugs such as they causes some type of conditions like cleft palate and hydrocephalus and multiple defects. ACE inhibitors causes hypoplasia of organs such as lungs and kidneys. And next one, mutagenicity and carcinogenicity. Capacity of drug to cause genetic defects and cancer respectively.